Hey everyone, I'm Mary Ann Pizzatola. I am president of the New York City Organization of Public Service Retirees. And I have some guests with me today, and we want to start a series where we're introducing retirees and how this new Medicare Advantage plan is going to affect them. Today, we have some special guests, William and Susan Shenton from New Jersey. And we want this to be a series of faces of retirees, because a lot of people hear about how Medicare Advantage will affect a retired person, but they don't really hear it specifically from the retiree themselves. So we want to put a face to this and that you can hear it in their own words so that you know that this is real. So welcome, Susan and William.
Thank you.
So introduce yourselves to us.
Sure. We're William and Susan Shenton. We live in Aberdeen Township, New Jersey, which is a small town on the Raritan Bay, just south of Staten Island. Susan, go ahead. You were raised in the Bronx?
Yeah, I grew up in the Bronx, and I went to Hunter College. And when I graduated, I went into, excuse me, I went into computer work, and I went to, I worked for Con Edison for, I guess, 6 or 7 years until my daughter was born. And then I went back to work when my younger daughter was in kindergarten. Mm-hmm. And I worked for basically insurance companies, but also in the systems area, and worked my way up from there.
And I was raised in southern New Jersey on a small farm. We met while we were students at Rutgers in 1967. Susan was a graduate student studying math, and I graduated with my BA in 1968. We were married in 1969 in February and lived in Rego Park, Queens until 1971 when we bought a house in New Jersey. I began working for the New York City Housing Authority in February '69 also. Okay. And I joined the employee pension system as soon as I was able and became active in my union's housing division. My union was Local 237 Teamsters.
And where were you working?
I worked originally in the Bronx, in the South Bronx, as a housing assistant at Mitchell Houses. And then I began to work in what was called Section 23 leased housing, which is a precursor to Section 8 housing, as an assistant manager until 1974, at which point I became manager of Gowanus Houses. And thereafter, I managed 3 other developments scattered around the city in Brooklyn, eventually winding up on Staten Island at South Beach Houses. Until 1990, when I was assigned to the main offices to work on developing and managing data solutions. I managed housing developments for 20 years working for the Housing Authority, and I found the work very rewarding and challenging.
Yeah, I bet you did.
I retired in December 2000. But returned as a consultant at first to document the programs I had written, and to train my replacement to maintain them. Later, I helped recover our systems after the 9/11 2001 attacks on the Trade Center, which was directly across from where we worked, at 90 Church Street. I was happy to stay in my union throughout this whole thing. While Susan always earned a better salary than I, her benefits did not compare with ours working for the city.
Right.
No, my pension is probably 4 times what she has in pension.
I had 401k, so.
But I always was covering us with the health insurance. That was our.
Well, and that's very typical of a city employee, is we made less, but our benefits were better.
Right.
Absolutely.
And we did that. That was purpose. I mean, we knew that going in. We knew that going in, period.
Absolutely, we did. And we counted on that.
Yes. And then, so now at this point, you're both retired. And Susan was on your health insurance.
Right.
Go ahead.
When we became eligible for Medicare A and B, when we turned 65, the city enrolled us individually because I became 65 before Susan. They enrolled us in the from GHI to the Emblem Health Senior Care. And throughout this time, we always relied on my union's health drug benefit.
So your welfare, you had a welfare fund through your.
We had a welfare fund with the union and it supplied our drugs, as I think a lot of unions for the city, they supply the drugs.
Right.
The drug coverage is not part of our negotiated health care plan. After 2014, Susan became ill. And in late 2019, she was prescribed a very expensive medication that costs over $12,600 a month for a 30-day supply. Because of this, and at the recommendation of my union, she had to buy her own Part D Medicare plan.
A private plan.
A private plan with Medicare, with a private health insurer. And no longer was able to use our union's welfare benefit. Which,
your union welfare fund also had a cap on prescriptions, correct?
yes, at the time in 2019, it was a $30,000 cap. This year, it's only $25,000.
You need to get a drink?
I do.
Go ahead.
It's a $25,000 cap.
So the cap went, so now they actually reduced your benefit, your welfare fund, your union actually reduced you by $5,000 a year.
It was 30,000 in 2000, I think.
Mm-hmm.
So this year is 25,000. I don't know what it was last year.
Gotcha. And so in order to have this life-saving medication, you had to find a way to pay for it. So your union, knowing that you would blow through that cap if they covered the medication, suggested you get a private Part D plan. What do you pay for the private Part D plan?
The premium's around 30 a month.
23 something. And
that's a very good deal, given that the city's trying to sells us
exactly.
a Part D plan for $125.
Absolutely.
But then I have to go into the
donut hole.
The donut hole thing and the become catastrophic, which I do in a month. It only takes a month to become catastrophic. And at that point, I pay 5% for the drug. But the first month, the January payment to the for the drug was over $3,000 this year.
And by the way, there's a Medicare catastrophic payment that they used to subsidize her out of pocket, so that she met the 70/50 with only a $3,000 and change payment.
Wow.
That was with the help of the pharmaceutical company.
Right. Apparently, the government Medicare requires them on an expensive drug like this to give a certain amount back and subsidize that 70/50 to get out of the donut hole. And by the way, that number changes every year. Last year it was less than 7,050.
Yes, I remember that. We had some retirees that had that, same issue. So now last July, you became aware that our healthcare was potentially changing when we learned about this secret vote that the MLC held about changing our insurance and enrolling all Medicare eligible retirees into a Medicare Advantage plan.
That is correct. And when I first became aware of it, I read the FAQs that the Office of Labor Relations posted on their website, and read that, that Susan would be disenrolled from her private drug plan if we went into this.
Yes.
By the way, our union wasn't aware of that.
Really?
When they had the first webinar, they were surprised. In fact, they got in an argument, and I don't know whether it was Kim Parker who was there attending that webinar, but it was back in August. And she had to tell them, no, that he's right. So I think Kim said at that point, well, you've got no option other than to opt out and pay the fee. Which I
Correct.
don't know what it was going to be at that point. They
Yes,
said
and-
somewhere around $200 a month, they said.
right, they weren't giving us straight figures then. And
That's
and,
right.
and for those that are watching this who are not aware of that rule, under the Medicare Advantage rules, you cannot have a private prescription plan, a private Part D plan. So if you do have a private Part D plan like Susan does, you will, when you enroll in a Medicare Advantage plan, you will automatically be disenrolled from your Part D plan. And if you don't know that it will happen to you, you will know because you're going to get a letter saying that you've been disenrolled. And you will either have to use your union welfare fund or purchase the city's Medicare Part D plan. And in your situation, like you've explained, or did we get there yet, that's actually not an option for you.
It won't work because my union does not cover her drug. My union plan, which is an Aetna plan, does not cover her drug. We've checked into this, and I've spent weeks and months on this, being aggravated by this. It's taken a toll on us all.
And whatever we do, we both have to do the same thing. We can't split it. I can't opt out and he stay in it.
So we have no choice, but are being forced to opt out. There's no two ways about it. And this is going to cost us an additional sum per year of $5,000, counting all the co-pays, considering the number of doctor visits that we had last year. And
because the city imposed a new copay on retirees of $15 a visit, which we did not have in the past. Correct?
That's correct. And it's going to cost us an additional $5,000 on top of the $1,000 a month that we already have to pay out of pocket. So it's getting to be outrageous.
So now, in addition to the new copays of $15 a doctor visit based on X amount of doctor visits that you had last year, plus because you both have to opt out because the city does not permit a couple to take, or a family to take several different plans or two different plans, you both have to opt out or both stay in. So since she has this problem where she must have a private Part D plan, that precludes you from being in the Medicare Advantage plan, which is the free plan according to the city. And in order to keep your current traditional Medicare and GHI senior care, which you had for free, you now will have to pay $194.40 per person per month to keep a plan you had for the last, I don't know, 20 years for free.
That's how I came up with the $5,000. It's $388.80 plus plus the $25 or $15 copays. It's more than $500 in copays.
Yeah. So this is a huge pinch on a retiree who's been retired for 20 years to have to now include this in your, yearly payments on a fixed income.
We've had to budget for this, and it's becoming increasingly difficult. So
I
bless those who don't have the money and have a situation like ours. At least we have enough money to cover it at this point. But there are people out there that made less than we did and who don't have the resources. And there are situations where we're being forced to pay this amount of money. It's not like it's an option for us. It's not an option.
You have no options.
Yeah.
No. And that the city also stripped away all other plans that you could have potentially opted into that might have been a little bit different for you. You left you really with no option at all.
None at all. So it's a shame, but I like Susan said to us, said to me, I mean, that we've always backed the unions and always thought the unions were great for us. They were, but we are now in a situation where we can't we're being backed into something that we forced into something that doesn't make sense really.
No, and this is the frustrating part is because you keep hearing the MLC and the UFT, I mean, Harry Nisboli and Michael Mulgrew and DC 37's Henry Garrido keep saying this is a better plan and it'll save money and it'll give you enhanced benefits. And for a family like yours, and you're not alone, I'm going to tell you from running this organization, our team runs up against retirees calling with very similar situations as yourself, being pushed against the wall and being told you don't have a choice. This is because of medications that you're taking that would not be covered by your plan, or that the Union Welfare Fund will not cover, or that you need to have a private prescription or private Part D plan. You don't really have any choice. And then now you're forced with, well, do I continue to take this life-saving medication and pay for a Part D plan, or do I not take it and risk my life or my health and take the free plan that they're trying to push on us? So it really doesn't leave you with a healthy choice. And the stress of all of this since July, I'm sure, has been great.
It has, and I want to thank you and your group for the help you've given us, and for the opportunity to tell our story.
Well, and thank you for sharing it, because I want this to be the first in a series. We have several retirees that their stories need to be heard just like this, and I'm hoping to bring some exposure to it to the active employees who do not understand this program. They don't understand these retiree issues. Most of them don't even understand the difference between Medicare Advantage and traditional Medicare, but they're going to learn soon.
Unfortunately. Well,
Yes,
thank
absolutely. So I'm going to end this here, and let me stop the recording. Thank you everyone for watching, and stay tuned because we will be interviewing a few more retirees in the next couple of days and help educate you as to what this program is doing and how your unions are misrepresenting this to you, the public, and us. Thank you.
Thank you.